Good morning, everybody. You were wondering what will happen to the rains, but the rains stopped in the morning. But they have started again now. What we are going to do today, because psychiatric disorders, as all of you know, are conditions which are more and more common in our society, and that is how we are lucky that our council has started MD in psychiatry. But unfortunately, I think what happens is that the way in which our undergraduate education goes, there is such a poor orientation to what psychological illnesses are, that it leaves a person who is in practice quite at loose end when it comes to how to tackle or how to understand common psychological disorders. And that is what now we have got the term common psychological disorders, not so much of a psychiatric conditions, because as you know that psychiatry has been a sort of a, you would call a black sheep in the family of physicians. And at least when I did my psychiatry from KEM, we were still on the fringes. You know how the lunatics are out of society. So psychiatric residents were also on the fringes of residency. So we were not a very popular brand, because there was often a misconception that people who are psychiatrists are also half crack. So that is how we have come up in the hard way. But I think homeopaths are a little better off. And I think you had one of my students yesterday in the evening, Dr. Chirag, and I'm sure that you didn't consider him as a half crack fellow. He was a fully sane person. He appeared to be that way also. So what I am going to do today is to only speak in terms of what are the first principles. It's not possible to cover psychiatry as a whole. It's a huge branch. So what I will be taking up are certain common clinical conditions that we encounter, and what is the approach that we must have to them. So that's why I have subtitled this presentation as first principles. What are the first principles? What are the foundations which we will need to understand through homeopathy? Because after all of us are going to be practicing homeopathy and going to use the homeopathic philosophy and the principles that all of us have learned. Right? So we are going to approach it from that area and trying to understand how certain conditions we can treat. So that is why I have not really gone into very complex psychiatric conditions, because complex psychiatric conditions will not see a homeopath commonly, right? But some of the conditions that I have taken up are useful because they will illustrate certain approaches and certain management strategies that it is useful to employ. So, right, so this is what, how should a homeopath receive the concepts which are current in modern psychiatry. When you are approaching psychiatry, since there is no psychiatric homeopathic textbook, so we will necessarily approach it from modern psychiatry. So if you want to understand depression, anxiety, I believe you have a class on anxiety in the afternoon. So when you approach this, you will be approaching from the modern textbooks. So how should a homeopath look at this, and how should he interpret in the light of Hahnemannian principles? So what we will be doing is, in this presentation, what is a mental symptom? First principle is that what is a mental symptom and how do we elicit it in our case taking. So we try to understand a mental symptom as an entity. Then we have to classify a mental symptom. So how do we categorize mental symptoms? What are the various sub-classifications that we have? how do we value and use this symptom in our clinical work? All of you know that we have classification of symptoms, mentals, physicals, generals, particulars, and then we evaluate, and then we say that some are more important and we raise them to a higher level. So how do we do that? How do we value and use this symptom? What is the importance of mental state? Mental state is a term that has been used in the organon, and a lot of materia medica images will also speak of the mental state. So what is this mental state, and what is the mental symptom, and what is the difference between the two? Difference in terms of the operational difference. So how do we place the mental symptom and the mental state in the Hahnemannian totality? So now you are able to see how we are going at a more and more abstract level. We start at the first step of a mental symptom. We try to understand what is the mental state. Then we try to integrate it into the totality. And then we are looking at what is a mental state and what is mental illness. Right? That is the what we would call as cross the bridge between homeopathy and psychiatry. Because if you speak in terms, if you speak to your Dr. Rao in the afternoon, and if you talk to him about mental state, he will not understand. Talk to him about mental illness, he will understand. Right? So we speak in one language, they speak in another language. So what is the bridge between the two? And how do we take the help of the therapeutic principles enunciated in the organon to treat these mental illnesses? Right? So we hope that we will cover this ground in a major way, and we will try to cover it through some of the cases that I have distributed to you. If you see that the cases that I have distributed are giving you a pattern of working. How do you take a case? How do you record a case? How do you elicit certain symptoms? How do you record the symptoms? So that is some part of the case study that you will undertake in your this thing. We cannot deal with all of them as a workshop because we don't have that type of time just now, right? But we will definitely deal with these cases in a particular way so that we will try to understand what are the implications of working in this pattern. And the cases are again cases that most of us are likely to encounter in our practice. Right, so this first case that I have taken is from our tribal area. Dr. Sandesh spoke to us about our community work that we do. So this is a community work that we are doing around Palghar, which is a predominantly tribal area, and this is the type of roads. These are the roads, these are the main roads, the highway of Palghar in the village. Right, and then we use a mobile van to go into these areas, and the mobile van goes on certain prefixed days, and we have a community health volunteer which belonging to the place, and they bring us certain ideas about what is the problem in that particular village. And in one of the visits, Dr. Manoj Patel, belonging to our institute, he was on the mobile, and he was told by a community health volunteer that there is one man who is unconscious in the village, so please try to see if we can do something. So we went, the jeep went in that area, and this is what we saw. Right, these are the patient was lying on the bed. So open house, you saw those houses, there is an open space outside, and in that open veranda this patient was lying down. There was an old lady who was with the patient, the mother, and only two people were in the house. And this man was lying down there like a dead body, not responding to deep painful stimulation.